So let's start with video 2 of unit 1 of drug abuse. The topic that we have to cover today is drug dependence. First of all, what is dependence? The words dependence and addiction are often used interchangeably, but there are important differences between the two. In medical terms, dependence specifically refers to a physical condition in which the body has adapted to the presence of a drug. If an individual with drug dependence stops taking that drug suddenly, that person will experience predictable and measurable symptoms known as the withdrawal symptom or the withdrawal syndrome. Although dependence is often a part of addiction, non-addictive drugs can also produce dependence in patients. A prime example is prednisone, a synthetic form of the steroid hormone cortisol that is used to treat asthma, allergic reactions. Prednisone is known to produce addiction. However, if a patient has taken prednisone for several weeks and then stops suddenly, they are likely to suffer from withdrawal symptoms such as fatigue, weakness, body aches, and joint pains. All of them are physical symptoms. Now, different drugs and substances will have different withdrawal symptoms and timelines depending on how they interact with the brain and the bodily functions. The drugs are absorbed and remain active in the body for different amounts of time. This is often referred to as the drug's half-life, which relates to the different withdrawal timelines for each substance. The severity and duration of withdrawal is influenced by the level of dependency on the substance and also on a few other factors, including length of time abusing the substance. That means how much time you have been abusing the substance, maybe 1 month, 2 months, 3 weeks, 4 weeks, whatever. Then the type of substance abused. What kind of substance? Is it alcohol? Is it opiates? Is it cocaine? Is it benzodiazepines? Then what is the method of abuse? Whether the abuser is snorting it through the nasal route, smoking it, injecting it, or swallowing it. Then amount of drug that is taken each time, that is the dose of drug that is taken, and the family history and genetic makeup, how sometimes addictions run in families through the genetics, through the gene histories, they are inheritable, and then at that present your medical and mental health factors. Now we look at the figure. You can see in benzodiazepines, the withdrawal starts, after if you have been taking benzodiazepines, then after leaving it for 1 or 4 days, the withdrawal symptoms appear. In case of heroin, as you can see here, after stopping the intake of heroin after 12 hours, you can see that withdrawal symptoms are there, and the withdrawal symptoms peak at this point, that is the at 24 to 48 hours. In case of prescription opiates, at 8 to 12 hours. After that, you start getting withdrawal symptoms, and they peak at around 12 to 48 hours. In case of alcohol, after 8 hours, you witness the withdrawal symptoms also, which is normally called as in the morning, when you take alcohol at night, and when you wake up in the morning, you experience the symptoms, withdrawal symptoms, and they peak at around 24 to 72 hours. And if we look at cocaine, the withdrawal symptoms appear within hours, and then they also can peak around within a day or so, and then for weeks, up to 10 weeks, the total duration is there of the drug withdrawal symptoms. Now, what are the emotional withdrawal symptoms? The abuser might get anxiety, may be restless, may be irritable, may have insomnia, that is inability to sleep, may have headaches, poor concentration, depression, social isolation, tries to avoid people. So all of these are the emotional withdrawal symptoms. Physical withdrawal symptoms may include sweating, racing heart, that means the heartbeat is quite elevated, palpitations, muscle tension, they experience a tightness in the chest, they have difficulty breathing, they have tremors or trembling, and they may have nausea, vomiting, or diarrhea. All these are gastrointestinal symptoms. Then there are some dangerous withdrawal symptoms. They also might have seizures, epileptic fits like that, then heart attacks, strokes, hallucinations, delirium, all of that. Dependence is caused by changes in the body as a result of constant exposure to a drug. Drug dependence is a medically treatable condition. The goal is to separate the patient from the drug slowly instead of suddenly, to allow the body to readjust to normal functioning. For patients who have developed dependence as a side effect of taking a needed medication, such as a painkiller, a doctor uses the tapering method, that is, slowly decreasing the dose of the drug over time to minimize withdrawal. For individuals who are dependent on illicit or prescription drugs due to abuse rather than medical need, there are detox facilities or detoxification facilities which may use a controlled taper method or may use certain medications which prevent serious withdrawal symptoms. They may substitute dangerous drugs with similar but safer drugs to manage dependence. For example, the people who are detoxing from heroin are often given a longer acting opioid like methadone or buprenorphine to alleviate withdrawal symptoms and cravings. Just as some drugs that cause dependence are not addictive, there are also highly addictive drugs that do not produce physical withdrawal symptoms. Even after long periods of abuse, psychostimulant drugs including cocaine and methamphetamine do not produce pronounced physical withdrawal symptoms like vomiting and shaking, although there can be psychological symptoms like depression, anxiety, and drug craving. Despite a lack of visible, measurable physical signs, chronic psychostimulant abusers may indeed be addicted. So even if there are no withdrawal signs, the abuser might have dependence on the drug. Now let's talk about the psychological dependence. When we become psychologically dependent on a drug, then drug dependence changes to drug addiction. So what is addiction? It is a chronic relapsing brain disease that is characterized by compulsive drug seeking, that means drug finding and use, despite the harmful consequences. Even though the abuser might know about all the harmful consequences, still that person actively seeks the drug and uses the drug. In other words, addiction is an uncontrollable or overwhelming need to use a drug, and this compulsion is long lasting and can return unexpectedly after a period of improvement. Addiction is a psychological condition that describes a compulsion to take a drug or engage in other harmful behaviors. Individuals can develop addictions to illicit street drugs, to prescription medications, and even activities such as gambling. Addictions are persistent, and addicted individuals can relapse into drug use after years of abstaining. So even though you might have not taken drugs, the drug abuser might not have taken drugs for a significant period of time, still the addictions are persistent and they can relapse, they can go back to using drugs. Although addiction used to be thought of as a sign of moral weakness, it is now understood by the majority of those in the substance abuse and addiction treatment sphere to be a condition that arises in association with changes in the brain caused by the use of addictive substances. So previously people used to think that that you are not strong enough mentally to resist the drugs. That is why you are dependent on drugs. But now scientists have proven that there is changes in the brain caused by the drugs. That is why you become addicted to the drugs. To the addicted brain, obtaining and taking drugs can literally feel like a matter of life and death. Addictive drugs stimulate pleasure and motivation pathways in the brain much more strongly than natural rewards. Therefore, repeated exposure to these drugs can fool the brain into prioritizing drug taking over normal, healthy activities. So, as you know, there are pleasure and motivation pathways in the brain. They are activated more strongly by these drugs rather than by natural things. So, the drug abuser will give priority to taking drugs rather than doing normal, healthy activities. The effect of drugs on the brain's reward pathways helps explain two important features of drug addiction. First, the inability to limit or cease substance abuse. So the person is unable to stop taking drugs or to limit the taking of the drugs. Second, the irresistible urge to continue seeking and taking the drugs despite serious negative consequences. The person realizes that there are very harmful consequences of drug taking. He sees it in himself. His physical structure changes, his mental structure changes, but still that person continues to seek and take drugs. This irrational persistence is what sets addiction apart from mere physical dependence. Many people in our society are dependent on caffeine, that is, when you take coffee, and experience withdrawal symptoms such as headache, fatigue, and difficulty concentrating if they miss their morning cup of coffee or tea. But no matter how unpleasant going without caffeine may be to people who are dependent on it, it is unlikely many of them would commit a crime in order to get a cup of tea or coffee, or refuse to give it up entirely if told by the doctor that it might kill them. Addiction results from a complex interplay of number of social, biological, and psychological factors, including genetic makeup, socioeconomic status, family environment, and drug accessibility. So there is a complex number of factors that are, interplaying when we talk about addiction. So it depends on what kind of genes you have inherited, what kinds of genes you have. There are some genes which predispose you to towards addiction. Then your socio-economic status, if you can afford the drugs, or if the drug abuser is in quite a lot of poverty and he's depressed. The family environment, how happy it is, how fruitful it is, and drug accessibility, how easy it is for the drug abuser to get drugs. The treatment of addiction is likewise complex. So because there are a lot of factors that affect drug addiction, similarly its treatment is also quite complex, because it requires many things like medical attention to get rid of the drug abuse, then behavioral counseling so that you don't go back to abusing the drugs, and long-term support to prevent relapse to taking the drugs. Drug addiction is a dangerous and often fatal condition, and it can be virtually impossible for an addicted individual to break the cycle of compulsive drug use without assistance. So assistance, whether by the family, by the medical community, by the government, is always required for a drug abuser to break that cycle of addiction. Now let us recall drug dependence and drug addiction. So what are the differences between them? Drug dependence is not a substance use disorder or disease, whereas addiction is both of these things. Dependence is a pretty predictable and normal process by which body physically adjusts to the presence of a drug and learns to rely on that drug over time. With addiction, these same features of physical dependence may be present, but they also accompany other psychological and behavioral elements. So if your body becomes adjusted to a drug, that is called as drug dependence. But if along with that your psychological and behavioral also changes because of the presence of that drug, then that is addiction. Drug dependence is not characterized by strong uncontrollable cravings, whereas addiction is. So when you have cravings, intense feelings of compulsion to use a drug, that is drug addiction. That is what feeds the substance abuse in cases of addiction. These cravings are a result of, as I told you earlier, are a result of actual changes in the brain. In both of these ways, cravings are unique to the disease of addiction. Drug dependence and addiction occur in different parts of the brain. When research was done on it, in brain scans or MRI of addicted individuals, the reward pathways in the brain light up. The ventral tegmental area, the nucleus accumbens, and the prefrontal cortex all are going crazy, whereas in physical dependence shows up in different regions of the brain, that is the thalamus and the brainstem. Here you can see the addiction pathways. These two arrows indicate this area, and this area is what is stimulated in case of drug addiction, whereas this thalamus area and this brainstem is this is present this shows up in these regions of the brain, that is the thalamus and the brain, that is the dependence. Drug dependence and drug addiction require different treatment interventions. Drug dependence essentially disappears with a long, slow taper off one or more drugs causing physical dependency. So if we just taper off the drugs, we slowly decrease the dose of the drugs, drug dependence will disappear. However, the disease of addiction requires a far more extensive plan of treatment involving multiple clinical and behavioral interventions, often in the context of medically supervised detox and inpatient treatment at a recovery center. So their treatment plans are also different. So these are the major differences between drug dependence and drug addiction. Now coming to the start from where we started, how drug addiction is different from drug abuse. While both concepts exist together on a similar continuum, there is a distinction to be made between substance dependence or addiction and drug abuse. Addiction, by some accounts, begins as a result of using a substance that has a measurable impact on the reward center of the brain, but it doesn't end there. The repeated stimulus of this reward center is enough to affect a change in the functionality of the brain itself. So when we repeatedly stimulate that reward center, the functions of the brain change. As the process of stimulating the reward circuitry, so to speak, becomes of paramount importance above all other aspects of an otherwise normal life. So the person continues to take drugs to activate that reward center, and all other activities of a normal life take a back seat. Whereas when we talk about drug abuse, it leads to an addiction, but it as a non-clinical concept, abuse encompasses any use of illicit substances or inappropriate use of medications. So drug abuse indicates abusing the drug. That means you are not taking that drug in a legal way. Either you are using illegal drugs or you are using drugs in a misuse way. For example, you are taking larger doses of the drug, you are taking it more frequently, you are not stopping the use of the drug. So all of that also comes under drug abuse. Next time we'll cover classification of drugs and their effects. I hope these concepts of drug addiction, drug abuse, and drug dependence and drug tolerance are quite clear to you via the two videos, video 1 and video 2.